We've heard a lot of fire, a lot of good discourse, which we wanted to have over this time. In closing comments, I would say, as Janet said, the system is broken. If we have 3 to 4% of people in this country and elsewhere participating in clinical trials, if even another 4% dabble in citizen science, we're still leaving out 92% of the people that need to be engaged. And we really need to think about how do we use the good concrete tools that are validated in order to engage them. I think we also heard that industry is ready in some sense. We saw the Medtronic example, and by the way, Harlan put his comments up on Forbes.com last night, so we can go and read them there as well. They're ready, and then they're not ready, we heard. We heard that's an interesting example, and I'd like to take that back to my company, but we're not ready to do it. So what do we need to do to make this a reality? We heard a lot about incentives, and that sometimes a disincentive is an incentive somewhere else. It's about aligning those and figuring out how do we create a new economy. I think we also heard about advocacy to some degree. It is probably in some sense my fault that we didn't actually look at some of the more formal advocacy community bridges that have already been built and are really old. In fact, Cystic Fibrosis Foundation, my own Genetic Alliance Registry, and Biobank, that's a platform across diseases to do the kinds of rigorous studies that we need to do. That infrastructure already exists, biobank.org and others. I was told when my children were diagnosed in 1994, you cannot get scientists to share information, which shocked me, by the way, as a private citizen. They said it's like herding cats, and I quickly learned that you can herd cats if you move the food. And the food was the blood and tissue and clinical information. So we do have sharing in some communities that's quite rigorous, as we saw in the Williams community as well. I think that the final comment I'll make is that it's about leadership. It's about leadership not just from the top down, and not for each of us to point to some other community and say, what about you? It's your problem, or you're the one who is the roadblock, or that whole community is the roadblock. I think when I hear that, I reflect internally and say, then how is it true that I am the roadblock? And what I'd like for each of us to take away from this workshop is, how is it true that we are each the roadblock and therefore also the solution, and not to look for it externally, but for each of us to move forward for the sake of all the people who need us to do this quickly, efficiently, and carefully. Thank you.